Hey, good evening. My name is Andrian, and I'm going to be talking about the PLAB examination. Like Kevin said, if you guys are interested to go into the UK, then this is one of the exams that you have to take. So how do you get to the UK? There are many options to go to the UK. One is through the PLAB examination, which is the exam that most of them take. Another way you could go is through writing MRCP. But I'll tell you the pros and cons of writing MRCP and PLAB examination. Now, when you compare the PLAB examination with the MRCP, PLAB examination has just two steps. It's got PLAB Part 1 and Part 2. Part 1 is an MCQ exam, and Part 2 is an OSCE exam. And if you compare that with an MRCP, it's 3 parts, and it's way expensive, and it's very hard because you need a lot of clinical experience. And usually MRCP is given by people who finish post-graduation. Okay? So why take the PLAB exam? One, because if you really want to go to the UK, yeah, and it's much easier compared to the other post-graduation examinations. When you compare it to NEET, it's way easier. When you compare it to USMLE, it's way easier. And it's less expensive compared to USMLE. I'm going to compare it to USMLE in this slide. It's not very expensive when you compare it to USMLE. And there's plenty of vacancies in the UK. They have a lot of shortage in psychiatry, in emergency, so they really need doctors right now. And you can study while working. You don't really have to take a break. You can study while you're doing internship. You can study when you're doing rural bond, and that's what some of my batchmates did. And the most important point, your scores don't really matter. If you take USMLE, you really need to get a good score to get in. And in PLAB, you don't have to get a good score. I mean, you just have to clear the examination and you can get into the system. You don't really require observations, unlike USMLE. It's good if you do it, and good if you do research, but it's not required. And people who are interested in psychiatry, emergency medicine, pediatrics, and internal medicine to an extent should be trying this route. One of my batchmates, he just passed his exam maybe in the month of February, and he reached UK maybe in April, and he got into training in just 1 month, and he got into psychiatry. So what is this PLAB examination? It's not a degree, it's like an entrance exam to enter the UK health system. And like I said, it has 2 parts, PLAB 1 and PLAB 2. PLAB 1 has, it's an MCQ exam, and PLAB 2 is an OSCE exam. And another important thing that I want to tell you guys is by 2022, they're going to replace PLAB exam into UK MLA, and I don't know how things will change after that. You'll have to look into the website and keep following up with that. So when do you give IELTS and PLAB exam? Now, sorry, I forgot to mention about IELTS. IELTS is an English exam that you have to clear if you have to write your PLAB examination. I'll be talking about that a little later. So if you decide to do rural service, which is very important because clinical experience counts, you could probably start giving your IELTS and PLAB examination during the 2nd year of rural service. And if you decide not to do bond, then the best time would be during your internship. Try to clear your IELTS and then give your PLAB 1 after internship. And who's eligible to write the PLAB examination? You have to finish your MBBS, and internship is not required, but it's better if you do internship here because it just complicates the whole process. You'll have to do internship in the UK, which is very hard to get, and you have to clear your IELTS exam. There's also another new exam called the OET. I'm not too aware of that, but yeah, I'll be talking about the IELTS exam now. So it tests 4 domains. They test you on listening, reading, writing, and speaking. And it's required for your PLAB 1 examination, which means you can't sit your PLAB 1 without clearing IELTS. And you require a score of 7 in each, that is 7 in each reading, writing, listening, and speaking, and an overall score of 7.5. There's plenty of study material online. You get a lot of PDFs, Cambridge IELTS books, and there's a website called IELTS Liz, which is free, and there's a lot of important things that you could learn from there. And an important thing that you have to remember is IELTS is only valid for 2 years. So it's important that you finish, once you clear IELTS, it's important that you finish PLAB 1, PLAB 2, and register with the GMC. So it's important that you really plan your timeline and give each exam. There have been people who've, probably given IELTS and taken a gap, and then they have to rewrite IELTS just because they need IELTS for JMC registration. So plan it well ahead. So what exactly is the PLAB 1? PLAB 1 is conducted in March and November in India, and they have many exam centers in Bangalore, Chennai, Kolkata, New Delhi and Mumbai. And in March, June, September, November, it's held in the UK. So like I said, it has 180 questions, 3 hours. It's very easy to pass this exam. However, recently they're making it a bit tough because a lot of people are taking this exam. And the pass score is about 60 to 65%. And your scores don't really matter. You just have to pass the exam. Cost, it's around £230. It's almost like 20,000 rupees. And like I said, it's held in Chennai, Bangalore. There's a lot of study material which is free online. And also there are some online MCQ banks and like Plabable, that's what I used. And you don't really require coaching. You can work, you can study while doing internship. Maybe just 3 or 4 hours of study. It's mostly clinical questions, things that you see every day in the clinics. Now the PLAB 2 exam, this exam you have to go to the UK. It's a little funny exam, it's a bit tough. It's an OSCE exam. I would say we're a little lucky because we're exposed to this kind of an exam in Johns. I think in community medicine you have an OSCE exam, and also after you finish internship you'll have an OSCE exam. When compared to the other doctors who come to write, it's something new for them, whereas for us you're at least exposed to this. And there are 18 stations and you get different case scenarios. You get 8 minutes to take history, examine the patient and manage the patient. And the thing about this exam is it's not clinical, I mean it is a clinical exam, but they test other things like your language and communication skills mainly, and whether you're being kind to the patient, and whether you address their concerns. It's a bit different from what we do. And you require a visa for this exam. You need a visitor's visa, and the cost for this exam is around 80,000 rupees. And passing this exam is a little tough compared to PLAB 1. But coaching is definitely required. You have to go to the UK to maybe coach for just 2 weeks. They'll tell you how to handle different case scenarios. And maybe for 4 weeks or 6 weeks of preparation and you're good to go for the exam. Again, scores don't matter, you just have to clear this exam. What do you do after PLAB 2? Well, after PLAB 2, once you clear, you're eligible to register with GMC, that is the General Medical Council. And you're eligible to work in the UK. So once you clear, you have to apply for a non-training job. Now the only difference between USMLE and PLAB is that in USMLE you can directly go into a training spot. It's not like that in PLAB. You have to work as a non-trainee, like a JR. You have to work for some time, gain some experience in the UK, and you have to get something called a competency signed. And after that you're eligible to work. Usually people work for around 6 months or a year, and then they get into training. Like if you really want psychiatry, it's very easy. Like I said, my batchmate got into training in just a month. And there's plenty of jobs, non-training jobs you can apply for. Like I said, especially being a GP, a lot of people do this. If you really want to be a general practitioner, you can go to the UK, and it's just a 3-year training, and then you become a consultant, a GP consultant. Especially for surgical specialties, it's very difficult. So if you're thinking surgery, I think you should think twice before taking the PLAB route. And training, there's something called core medical training and core surgical training, and totally it will take about 8 years, and that's very long compared to the other countries. But you will finish as a specialist once you finish training. So the total cost for the whole thing would be around 4 to 5 lakhs. That is including PLAB 1, PLAB 2, your expenses in UK. But that depends on how much you also spend in the UK. If you really, save, if you probably just stay in a cheaper accommodation and cook, you could save a lakh actually. So that's it. There are plenty of blogs online. There's something called Nasir's Journey. There's a lot of information about this and Road to the UK. And Omar's guidelines is for people who want to do surgery in the UK. It takes a lot of time and a lot of effort. But I don't think, it's possible. Anything is possible. So you can check out these blogs. Does anyone have any questions? You're free to ask anything. Yeah.
What do you mean by non-training jobs?
Yeah, so non-training. So in the UK they call it training and non-training. So non-training is when you're post MBBS, you can just work as a junior resident without doing post-graduation. So that's a non-training job. You're not into any kind of specialty training. Whereas training is post-graduation. You're training to become a specialist.
So you take up like your specialty or?
Yeah, so if you want to become a specialist, like I said, you go there, you start working in a non-training job, you get some experience, and then you have to clear your MRCP exam. So MRCP or MRCS for surgery, it's like an entry exam into post-graduation. So you get any specialty, for example, you can get into medicine, and then you do 3 years of co-medical training, and you have to write another exam to get into specialty training. Yeah. Is anyone thinking of writing PLAB exam? Nobody. Yeah, okay. Any other questions? Alright, thank you. So feel free to mail me if you have any doubts. I can clear them if you like. Okay, thank you.